You died in the office, not at home, not on the commute. In the cubicle they demanded you return to. The autopsy listed cause of death as collaboration. They called it the return, capital T, capital R, like it was a homecoming, like you'd been waiting. You hadn't been waiting. For 2 years, you'd worked from your kitchen table, delivered every project, hit every deadline, exceeded every metric. Your productivity scores were the highest they'd ever been. Then the memo arrived. Subject line: exciting news about our future. The future required your physical presence. Monday through Friday, 8 a.m. to 6 p.m., non-negotiable. The reasoning was clear: collaboration, innovation, culture, connection. The words sounded important. They felt empty. You calculated the math. 3 hours of commuting per day, 15 hours per week, 60 hours per month, 720 hours per year. That's 30 full days. An entire month gone. Not working, not living, just moving your body from one location to another so you could do the exact same work you'd been doing. In a worse chair, under fluorescent lights that hummed like dying insects. But you went because rent doesn't negotiate, because health insurance isn't optional, because collaboration was mandatory now. Day 1 felt surreal. You sat in your assigned cubicle, 6 feet by 6 feet, grey walls, no windows. The ergonomic assessment called it adequate workspace. Your first meeting started at 9 a.m. You opened your laptop, you joined the Zoom call. 7 people on screen, 4 of them were in the building, 3 of them were 2 floors above you. Nobody suggested meeting in person. The calendar invite said Zoom, so you Zoomed, from your cubicle, alone. At 10:30, another meeting. Zoom again. This time, 5 people. All of them in the office. None of them in the same room. You could see Janet through the glass partition. She was on the same call, 20 feet away. You waved. She didn't wave back. She was on mute, presenting slides about synergy. Lunch happened at your desk. You'd forgotten to pack anything. The cafeteria was closed. Budget cuts. You ate a protein bar that tasted like Optimism's corpse. 1 p.m. Department sync. Zoom. 2:30 p.m. Project status update. Zoom. 3:45 p.m. Stakeholder alignment session. Zoom. Every meeting could have been done from home. Every single one. But you were here, in the office, for collaboration. The collaboration happened in Slack, and email, and Zoom, same as before. The only difference was the commute, and the cubicle, and the fluorescent lights, and the protein bar lunches, and the loneliness. That was new. At home, you'd been alone. But you'd had your kitchen, your coffee, your cat, the window that showed actual sunlight. Here, you were surrounded by people, hundreds of them, all alone, together, in separate cubicles, on separate Zoom calls, wearing separate headphones. The proximity was mandatory. The isolation was a feature. Week 2, your back started hurting. The adequate workspace chair was not adequate for your spine. You requested an ergonomic assessment. The assessment happened 4 weeks later. Via Zoom, the specialist recommended a better chair. The chair was approved. It arrived in 6 to 8 weeks. Your spine fused in 3. Month 2, you noticed the energy cost, not the commute, the performance. At home, you could be tired. You could wear sweatpants. You could be human. In the office, you had to perform humanity. Smile in the elevator. Make small talk at the coffee station that replaced the cafeteria. Pretend you were grateful for the opportunity to collaborate. The performance required more energy than the actual work. By month 3, you were working 10-hour days. Not because there was more work, because you couldn't focus. The open office concept was designed for collaboration. It delivered distraction, conversations everywhere, phones ringing, someone heating fish in the microwave, the HVAC system that sounded like it was dying but never quite died. You bought noise-cancelling headphones, $75. They helped. But they also meant you were even more isolated, in a room full of people, wearing technology to pretend they didn't exist. So, you could focus on Zoom calls, with people in the building who were also wearing noise-cancelling headphones. The collaboration was thriving. Month 6, they measured engagement. The survey had 43 questions. Question 12. Do you feel more connected to your team since returning to office? You wanted to answer honestly. You clicked strongly disagree. Then you remembered that surveys weren't anonymous. They said they were. The privacy policy said otherwise. You changed your answer to neutral. The results were published 3 weeks later. 87% of employees felt more connected. Leadership celebrated. You didn't feel connected. You felt observed. There's a difference. Month 9. Your body started keeping score. The commute destroyed your sleep schedule. Up at 5 a.m., home at 8 p.m., in bed by 10, asleep by midnight, awake at 2 a.m., anxious about the commute. The cafeteria never reopened. You ate protein bars, then granola bars, then you stopped eating lunch entirely, easier than pretending food had taste. Your screen time went up, not because you were working more, because you were working worse, distracted, interrupted, performatively present. The doctor called it stress. Prescribed meditation apps. You downloaded 4. You never opened them. You didn't have time. Month 12, you got promoted. Senior associate. Congratulations. The email had confetti animations. The promotion came with a new cubicle, 7 feet by 7 feet, still no window. And a new responsibility. Encouraging team collaboration. Your first initiative, mandatory in-person meetings. No more Zoom for people in the building. If you wanted to meet, you had to physically gather. Conference room B, every Tuesday, 10 a.m. Week 1 of the new policy, 6 people showed up, out of 15 invitees. The other 9 were on Zoom, from their cubicles, because they had back-to-back meetings and couldn't physically move between rooms in 5-minute intervals. You sat in conference room B, with 5 people, on a Zoom call with 9 people. The collaboration was award-winning. Year 2, they published the study. Internal research. Confidential. Leaked to you by someone in HR who'd had enough. Productivity was down 18% since the return. Turnover was up 41%. Sick days had doubled. But office utilization was up 73%. The metric that mattered wasn't output, it was presence. You read the study at your desk, in your 7 by 7 cubicle, at 8:47 p.m. Everyone else had gone home. You'd stayed late, to avoid traffic, to delay the commute, to pretend you had a reason to be here. Your laptop pinged, a meeting invite, tomorrow, 9 a.m. Subject line, exciting update on our hybrid future. You didn't open it. Researchers documented it. They called it the proximity paradox, the phenomenon where mandatory physical presence creates measurable emotional distance. You were closer to your colleagues than ever before. You'd never felt further away. The collaboration was working exactly as designed. The loneliness wasn't a bug, it was the point.